everyone, I'm Sam.
And I'm Kaitlyn.
And this is Team Get Ovary It.
We're an all-female team participating in the greatest motoring adventure on the planet,
the Mongol Rally.
We'll be driving 10,000 miles across mountains, deserts, and unknown terrain.
And along the way, we hope to spread our feminist and environmental ideals.
Join us here as we share our stories, thoughts, and interviews as we get ready for the Mongol Rally 2021.
Hi, everyone. Welcome back to the Get Ovary It podcast.
Hello.
Hi.
We are super excited today because we are sitting here with Dr. Celestine, a board-certified obstetrician and gynecologist who specializes in minimally invasive gynecological surgeries and is the creator and host of the amazing podcast For Vaginas Only, which we'll link in the description of this episode. So today we're going to be talking about some of the most common questions and misconceptions surrounding the reproductive system and its associated healthcare. So first off, welcome Dr. Celestine, and thank you so much for coming on.
Hi. Thank you guys for having me. I'm so glad to be on here and to bust some of these myths.
Yeah, let's get right into it. We've got to say, we already told you before we started recording, but we loved your podcast. Everything about it. You're hilarious in your delivery of the information, and we were just honestly shocked with how little we know about our own reproductive system. So, Dr. Celestine, could you start by just telling us a little bit about yourself, what you do, and how you got started with the podcast?
Yeah, so like you said, I'm a board-certified OBGYN. So not only do I do surgeries, I deliver babies, I see patients in the office, I do GYN exams, the whole gambit of the spectrum of my field. I've been practicing on my own since 2016, and I actually started the podcast in 2017 because I just felt like there was a lot of misinformation out there and a lot of people that just didn't even know, didn't have the ammunition to ask the right questions. People coming to my office, not just my patients, but my friends, my family. And I wanted a resource for everyone to be able to know what I know, because what I know shouldn't be so elite. It shouldn't be just me that knows this. I feel like everybody needs to know what I know. So that's why I started For Vaginas Only, the podcast.
I love what you just said there about not even knowing what to ask or what you don't know. And it's so true. And I think that's what your podcast does really well, is sort of gives the information so that we can start asking the questions, right?
Exactly. That's one of my main goals. I'm not expecting you to be a doctor to know every little thing, but I hope that every person out there can at least understand their body and what's going on with them.
Yeah, totally. So
Yeah.
along that vein, because, we just said generally people are pretty unfamiliar about their own anatomy, and they often shy away from using proper names for their sexual organs. So I would like you to, if you could you briefly name the major female reproductive and sex organs and describe their function?
Sure. So a lot of misconception kind of starts with calling it the vagina, right? So really when you look at the female genital organs, the outside, what you're seeing, which kind of looks like lips as we describe them, that's actually your vulva or your labia. They can kind of be interchangeable. So you have larger ones on the outside and smaller ones with no hair on the inside. So that's your labia majora on the outside and labia minora, which are the smaller ones, or minor, on the inside. Where those come to a peak at the top, that's where the clitoris is. A little bit below that is the urethra, which is actually where you urinate or pee from. And then even below that, the opening and into that tunnel is what is the actual vagina. So the vagina is actually inside of your body and not any of the external structures.
I remember when I first learned that, honestly, I'm going to say it for the entire interweb to hear, I just learned that a month ago. And it was one of those moments where you're just your brain just sort of implodes. You're oh my God, because you always hear it. And I think you talk about this in your first episode, people very generally refer to, I guess, sort of the female reproductive organs and what you can see as the vagina. But in reality, you can't actually see the vagina
I know.
from the
Yeah. And
outside.
I can't say I don't do that too. I kind of just make it
Hmm.
simplistic.
Hmm.
But I hope that, the people that I'm speaking to or just using that terminology with will either ask me what I mean or understand that I'm just making it simple. Because it's difficult sometimes to just say, oh, that's going on your vulva. Like if you're just having a conversation with
Yeah.
friends, you're not really
Mm.
going to say that.
Yeah, yeah, I can imagine, like, especially, like, I think it's something the distinction is
Yeah.
just now starting to be made in, like, sort of conversations with people.
Right.
So
Which
it's
is
like when
great.
you're like yeah, and it is, but, like, if you're talking with friends and you're like, "Oh, I have this going on with my vulva," and then they're just like, "Excuse me?
Yeah, I
You're
know.
what?"
It does feel a little strange. But I feel like a lot of people too. I don't know if you guys watched Orange is the New Black, but they had an episode kind of
Mm.
about the vagina anatomy. And I feel like that's when a lot of
Ah.
patients and friends were kind of coming to me like, oh my gosh, I can't believe I didn't really know that. So that was a pivotal moment too.
It was. And sort
Yeah.
of speaking of the vagina, let's just like get right in there. We want to talk about vaginal discharge because I think it's something I know for me personally, like in my own healthcare with like my reproductive organs, it's been something that's like I've been unsure of. I don't know sort of like how much is normal. And I think that's a conversation you see happen a lot. It's like, is this discharge normal? Like, when should we be concerned? So, like, in your expert opinion, like, well, first off, what is vaginal discharge and how much is normal and when it, or if people should get concerned about it?
So vaginal discharge is just a fluid secretion from the vagina. So the vagina has different glands associated with it as well, and it just secretes a fluid. So in terms of what amount, there's no technical amount that's normal versus
Mm,
abnormal. It's more one, understanding what's normal for you, because some people don't understand that you can have discharge every single day. So I'll have one completely normal patient that has discharge every single day, and another completely normal patient that only sees discharge maybe right before her period or something like that. So everybody kind of has a different their their vaginal area has a different way of producing this fluid. What's more important is kind of understanding what's abnormal. So if
hmm.
it has an odor that you're not used to, or if the color changes, if it's yellow, green, even like a grayish color, because mostly the normal discharge is either white, sticky, clear. Sometimes it could even be like an egg white kind of consistency, and it also changes with your menstrual cycle. So, right before ovulation, the discharge is a little bit different than after your period. So, it can change multiple times throughout the month.
Okay, so it's really
So,
about getting to know your own vagina and your own
exactly.
discharge then. Okay.
Exactly. Yeah,
Time
and if
to
Oh.
you're
become friends with
unsure,
your
just ask the doctor because it's so easy to. And I talk to people about this almost every day. And I'll even test it for them, show them what I'm seeing so that they understand that this is actually normal, even if their friends think it's not.
Oh, that's fantastic though. Yeah, I really like that. I liked because I yes, we were listening to your podcast yesterday
Yeah.
and I loved that you were just like, "Okay, guys, grab a mirror."
Yeah.
Mhm.
I know.
Yeah,
I
I
think
think
it's
that's
one of my
so
like favorite
good.
episodes is the vagina anatomy one because it's just
Yeah.
so all of my episodes are just kind of like I'm talking. I'm just talking to you guys, I'm talking to my friends, and I'm wanting you to
Mm,
really look. Like, yeah, grab that mirror, take a look, point at the things I'm talking about, separate the labia, figure it
Mhm.
out because you need to know.
yeah. Yeah,
Yeah,
and
it's
like
kind of like fun. It's like a hands-on podcast.
Yeah.
You're not just listening, you're experiencing. Like, let's get in there together. I loved it.
Thank you.
it's fantastic. So, okay, so especially about discharge, there are tons of products out there marketed to people with like vaginas to improve their
Mhm,
vaginal hygiene. Like I
mhm,
remember, gosh, what was it like? Those commercials that are saying like, "Oh, well, if you want to feel fresh," and that that always really confused me because
mhm.
I didn't really understand what they were saying exactly. So do you
Yeah.
think that those kinds of products, are they helpful? Are they harmful? What does work? What doesn't work? Do we need to use them? What do you think?
It depends on the product. So I think most of the ones that are advertised, they are
Mm.
kind of on a spectrum. So on one end of the spectrum, you have douches, which I never think are needed. So
Mm.
really, no one should be buying any product that you're actually inserting a fluid into the vaginal canal to quote unquote clean it out or make it fresh, because that actually can cause more infections,
Mm.
because your vagina has a natural amount of bacteria. And although the word bacteria doesn't sound clean all the time, it is. It's a perfect balance in there to keep your vagina clean. And when you're washing it out with a douche, it messes everything up and can cause infection. So that's never, never, ever required. Some of the other ones, like the wipes or like the washes that you
Mm.
just use on the outside, I'm kind of 50-50 on them. I feel like they're not like the best thing you can do to clean the whole vagina, well, really your labia, right? Because you're only really supposed to clean
Mm.
the outside.
Mm.
Is just mild soap and water every day. But sometimes if you're going to the gym, or if you're, getting really sweaty with any other activity and you're not showering and you might be just going straight to work or whatever, it might be helpful to use one of those just like pH balance wipes, or, something in between when you can't get a shower in. But to use them regularly, I don't think is necessary. And I don't believe that really any OBGYN thinks so.
Mm. Yeah,
Mm.
that's really good to know. That's really helpful.
Yeah. And some people can be
Yeah.
allergic to these products.
Oh.
So you don't really want anything with scents near your labia and your vulva. Sometimes that area responds differently than other areas of your body.
Mm.
Mm. Yeah, I think you say it in maybe your first episode where
Mhm.
you say, like, if you have something you've been doing your entire life and
Mhm.
it's working for you, like, don't change it. Like,
Mhm.
don't switch to a product just because you have a friend that's using it, which is true.
Right.
There's an entire, like, there are buildings and buildings of, like, corporate marketing, like, people
Yeah.
that are trying to figure out how to get you to buy this
Yeah. People are
stuff.
making millions off of it. It's
Mhm.
really, I don't know, it worries me sometimes, but
Yeah.
Yeah, it can
Yeah.
be.
yeah.
Um, okay, so let's talk about sort of, I guess, the flip side. Like if something happens and maybe your like vaginal area doesn't get kept clean.
Mhm.
So sort of speaking of, and that it's not always the cause, obviously, but like yeast infections, talking
Right.
about yeast infections. Because many people with vaginas experience yeast infections. Some
Mhm.
have them like recurring very
Yeah.
easily, some maybe only once or twice in their lifetime. But can you tell us a little bit like what is a yeast infection exactly? And is there sort of a best way to treat it or prevent it from happening?
Yeah, so a yeast infection is just an overgrowth of yeast in the vagina. So the vagina normally has some yeast in there. That's part of that
Mm.
normal bacteria, normal kind of what's going on in there. But certain things can make a shift in the bacteria and the yeast and cause the yeast to actually start to overgrow beyond any of the other bacteria in the vagina. And that's how you get a yeast infection. It's not an STD first and foremost.
Mm.
It's
Mm.
literally just a change in the what we call the flora of the vagina, or the
Mm.
pH of the vagina, that causes this overgrowth of yeast. Now, everybody experiences it a little differently. Some people, I have some women come in to me at like 65 years old and they're like, "What is this? I've never had this before." And then there's
Oh.
some, young girls that have it every month, every 2 months, and they're like, "How do I get rid of it?" So everybody kind of has a different trigger. Some
Mm.
common triggers for yeast infections can be like using a new condom that you haven't used before.
Mm.
Some people might get it with a new sexual partner. Not that it's an STD, but it's like their partner's new bacteria is coming in contact with their vagina and it's changing the
Ah,
flora.
okay.
So that could be a reason. It could be sometimes what you're eating. Sometimes it's super simple. It's hard for people that have it chronically, meaning all
Mm.
the time. We have to try to figure out what treatment works for them. We have to figure out what their trigger is, because everybody has a little bit of a different trigger. And sometimes it just stops out of nowhere. I've also seen some yeast infections more common with certain people, depending on what birth controls they're using as well.
Hmm.
Oh.
Um, so it's different. It's kind of, you have to play with it. Even as a doctor, it's not always cut and dry.
So can birth controls have an effect on sort of how easily you get a yeast infection?
Not necessarily. I wouldn't use that as a blanket statement at all.
Okay.
It's just certain people are sensitive to different types of hormones. Every birth
Mm. Oh,
control
that
has a
makes
different
sense.
hormone, and sometimes they respond. The vagina flora, or the bacteria and yeast down there, respond differently. So don't always blame your birth control. And definitely not. We were like running out of ideas at something that sometimes I try.
Okay, that makes sense.
Yeah,
Yeah.
that's pretty wild because I even have some friends and they say like every time they take, what is it? Antibiotics, they get a yeast
Oh,
infection.
yeah. That's because it's killing the bacteria in the
Uh,
vagina. So it's allowing the yeast to take
Oh.
over. So all the other bacteria that keep the yeast at bay are gone
mhm.
because the antibiotic killed it all. So now the yeast is just like going crazy.
Wow.
That's a main. That's like I can't even believe I didn't say that one. That's like the number one reason.
Yeah. Well, that's
Wow.
wow. Yeah, there's wow, so interesting. Ooh,
Yeah.
ooh, our
This is like
bodies are
honestly
very
blowing
interesting.
my mind. I don't know if you can see like the little smoke coming out of my ears right now,
I
but I'm
can
just
see it.
sitting
I can
there.
see it from over here.
Wow, that's really yeah. Okay.
Yeah.
So then kind of along that same vein of, prevention or
Mhm.
checking and getting to know your body. And this is something that I think has changed a lot, like even in the last 10 years. Like I know I kind of talked about this with my friends in the past because sometimes like what's recommended keeps changing and there's a lot of confusion. So I'm talking about like pap smears and pap tests. Because
Mm.
I think I remember talking to my friends like when I turned like 2021, it was time for me to go get my first pap smear. And then some people were like, "Oh, but," because like I wasn't sexually active then, so they were like, "Oh, but you're not sexually active. You don't need to get one." And then I
Yeah.
have other friends that are like saying, like, "Why do you go so often? You don't have to go this often." And I was just like, "Oh, I don't know." So I would like to know who should get a pap smear and when should you start getting them and how often should you get one?
So you're not completely wrong. The rules
Okay.
have changed, but they changed a long time ago. But a lot of
Oh.
people, yeah, but a lot of people are still, if they're older than you, perhaps they might have
Mm,
started their pap smears at a different time than what's actually
Mm.
recommended now. I would
okay.
say the rules changed back even when I was in residency. So that was like
Well,
mid
yeah. I
2000s.
live in like rural Canada, so we're like
Yeah.
10 years behind.
Well, yeah, and I mean, you guys probably even have different rules up there.
Possible.
But now the rule for pap smears, at least, is that they start for everybody at age 21, regardless if you're sexually active or not. But that's not to
Okay.
say that's the first time you go to the gynecologist, which is another kind of myth out there. You don't just wait
Mhm.
for a pap smear to go to the gynecologist. It's actually recommended that you go for the first time somewhere between the ages of 13 and 15 because that's
Oh,
where we
okay.
talk to you just about because you're developing, you're a teenager,
Mhm.
boys are starting to come into the picture, your body is changing, and we talk about all of those things. And come every year, or we even have to talk about birth control depending on because some young girls are active at that time. So
Mm.
there's lots of benefits to coming to the gynecologist earlier. But pap smears will start at age 21, and usually breast exams start at age 20.
Oh,
And the pap smear, depending on what type of pap smear that you get done, usually it's every 3 years until the age of 30. And then at 30, we start adding on the HPV test or the human papillomavirus test to the pap
Mm.
smear. And that allows us to spread out the pap smears to every 5 years. So as long as your pap smears are normal this whole time, that means you get it every 3 years from 21 to 30 and every 5 years from 30 on.
wow.
Yeah, but you still need to go to the gynecologist every year.
Okay,
Not to
okay,
make
Okay.
it
okay.
even more confusing because
Mhm.
there's a lot of things that we do. Like every time, another kind of myth is that, every time I go into somebody's vagina, they think I'm doing a pap smear, and that's not true. We are looking for
Mm.
different things. There's STD testing. There's different things that happen to the vulva and inside of the vagina that's not always a pap smear. So I do a vaginal exam on you every year, but not
Mhm.
always the pap smear, which is actually taking a brushing of the cells on the cervix. So it's a specific test. It's not just me going in there.
Oh, that makes so much sense. Because when I was sort of in my early 20s, I
Yeah.
think, it's, like, right around the age, like, I'm gonna question the doctors, I'm questioning authority. Um, and I remember hearing, like, you get a pap smear, it should be every 3 years, and I
Mhm.
remember going to an appointment at my gynecologist, and they're like, "Oh, well, we're gonna do a vaginal exam," and I was like, "No, but I had a pap smear done last
Yeah.
year," and I mean, she was just sort of like, "Well, just lie back, like, let us do our job," which is fair, like, I have, like, no, like, experience or
Aw.
expertise,
Yeah.
but, like, this
I feel like
is
she should
now
have explained
making
it to you though.
I mean, I hope so, like, I hope, like,
Yeah.
gynecologists in the future
Yeah.
explain so that there's not, like, another out there, like, being like, "But why?" Like,
Exactly.
but no, that explanation,
Yeah.
like, just made a light bulb click, so thank you.
Yeah,
Yeah.
a lot of people don't know that. Everybody thinks as soon as I go in the vagina, that's what I'm doing. But the PAP is super specific. It's looking for changes of the cells on the cervix. And then once you get
Mm.
over 30, it's looking for the HPV virus. And the whole point of PAP smears is to look for precursors for cervical cancer. So it's not that you have cervical cancer, there's like pre-cancerous cells and early changes due to usually the HPV virus that we sometimes have to act on to make sure that you never get cervical cancer. So the pap smear is a very specific thing that is done at the gynecologist. It's not just the vaginal exam.
Mm.
I was just wondering since we mentioned it, and I think like HPV is sort of something that like it's not like it's not one of our original questions, but just because we mentioned it, yeah, because I know these days because I think. Like I said, I'm from rural Canada. We're at least 10 years behind. When I was a teenager in high school, we didn't talk about like the HPV vaccines, but I think
Mm-hmm.
these days I've heard a lot about it. So I've heard about like Gardasil,
Uh-huh.
but then also like, I don't think, yeah, I haven't had it. I haven't gotten the HPV vaccine. And then
Mm.
I'm just wondering because I've heard like once you've reached like, was it 26, like it's kind of too late to get it. Do you agree with that? Or like who should get an HPV vaccine? What is it
So
exactly?
initially it
Mhm.
was for the ages like from 9 to 26 for females.
Right.
And males can get it as well. So a lot of times, at least these days, like when I first got the HPV vaccine, I was 20. It's when it first came out. It was just the Gardasil. It only protected you against the four most common types of HPV at the time. So, and if you have already been exposed to HPV, it's not going to protect you against the types you've already been exposed to sexually, because that's how you get
Mm.
it. It's only the others that are in the vaccine. But now there is a vaccine that protects you against the 9 most common types of HPV that can lead to
Mm.
cervical cancer. So it's even a wider spectrum. And ACOG, which is kind of like our governing body for OBGYNs, they're actually pushing to get it approved up to age 40. They're saying females up to age
Oh,
Oh,
40 can get
wow.
this vaccine. So I offer it to all my females up to that age group. The only thing that hasn't really caught up yet is insurance coverage. So right
Mm.
mm,
now, insurances, at least in the United States, are covering it up to age 26 and maybe depending on your insurance, not up to age 40, even though that's what we're recommending now.
okay. That's interesting.
Yeah.
Bouncing
So
off this, I remember sorry, you were gonna say something, continue.
no, I was just going to say that, that's kind of why people probably still say it's till 26, even though we're kind of
Okay.
pushing it a little bit further out because a lot of women as they get older now they're even getting new sexual partners, some people are getting divorced or whatever, and they're getting exposed to different types of HPV, so it's not just to protect young women and girls.
Mm.
Sometimes older women and girls need this protection too,
Yeah,
or
that's
older
so
women,
important.
yeah.
Yeah. So, going off this, I remember in your I think it was your Pap smear episode where you talk
Uh-huh.
about Gardasil and
Hmm.
HPV. So for example, I got Gardasil when I was 15 maybe, so I had like the 3 doses of it.
Uh-huh.
But I remember you saying it's not recommended to get the new
Right.
vaccination that includes the I guess like
The
protection against like
9.
the 9 type.
Yeah.
Is that so is there like a reason for that or
um I think the reason is that because the most common HPVs, they're numbered, all the HPV
Mm,
viruses. So there's like 16 and 18, for example, are the most common ones that can lead to cervical cancer. And that was in the original vaccine. And then the 9 kind of expanded to 41, 45, all these different other numbers. So I believe the thinking is that you kind of already protected against the most dangerous strains, the 16 and
okay.
18, and not necessarily needing the other ones. I'm not really sure how I feel about that though. I'm still because there are these other strains and they've
Mhm.
identified it. So it's like why can't I just get the vaccine that extends it? So I really
Yeah.
think it's a great question. And I might be starting to propose that question soon myself. And I feel even in my OBGYN magazines that I get and things like that, there's new things coming out with HPV and the HPV vaccine.
Mm.
So I don't think we're done yet. That's the recommendation right now. I'm not sure if I 100% agree with it, but that's where we're at. And we'll see what happens in the future.
Yeah, just it's like a stay tuned.
Yeah. Yeah. But I'm in your boat. I have the same one. I only have the 4, so
Okay, so if it changes, let me know if
I
you're
will.
like, recommendation is different, go get the vaccine. Okay, so pivoting,
Yeah.
just a little bit, still obviously same topic
Yeah.
overall. Your episodes on PCOS and endometriosis are quite popular.
Yes, they're my most popular, I think.
Um, I understandably, because I think there's a lot of like misinformation or non-information about
Yeah.
it. Because I remember personally when I was leaving Korea, I think it was like a pap smear maybe a few months before, and they were like, "Oh, you have PCOS," and then like just like left it at them. They're like, "There's nothing. Just
Lovely.
continue living your life."
Yeah.
So how common are these conditions, and how are they treated? Are they treated?
Yeah, they're pretty common. I can't off the top of my head, I don't know the exact number of people out there that have them, but in the people that I see in my office, I mean, all the time. A lot of people have
Okay.
PCOS, a lot of people have endometriosis. They're super, super common. And they don't really get treated well, or at least spoken about well, or discussed well with
Mm.
everyone. So potentially that's why my those episodes are the most popular, because everybody's just trying to find information.
Yeah.
And they can be treated. There's many different ways that we can treat both PCOS and endometriosis. Um, PCOS in particular, it depends on what your goal is. So if it depends on if you're trying kind of to get pregnant or not, or it depends on if you
Mm.
want to be on hormones or not, um, which route we go with the treatment. There's even like some diets and things out there that can help, and a little bit of weight loss and things like that. So you don't necessarily have to be on birth control to treat either of these, to be honest. Endometriosis is similar as well. It's a little bit more tricky with endometriosis because like the amount of endometriosis you have is not necessarily correlating to your symptoms. So if I would look into
Mm.
your abdomen, while you're asleep and with a surgery, I might only see a few spots of the endometriosis, but your symptoms might be, very painful, lots of issues. Or I might see your whole entire abdomen has endometriosis and you have like no symptoms. That's not even why you came to me. So it's a little
Oh.
bit tricky with endometriosis, but we can usually find a way to manage it. With that being said, some people they don't get 100% relief with the pain and different issues that they have with endometriosis, but hopefully we can at least get to a better lifestyle or a life, period. Because a lot of people with endometriosis, they're really struggling trying to just
Mm.
be normal, be themselves. So that's kind of the goal there. Every person is different. So it's really hard for me to specifically say what to
Yeah.
do
Yeah.
because everybody's different and we have to kind of figure it out. And it's not just a one-time visit to me and I'm like, "Oh, this is it and we're done." We have to
Mm.
try different things sometimes over a few months or years even to figure out what's going to work.
Mm.
Yeah, it's tough. It's really tough.
It is tough, and, like, I really appreciate that, like, you're here and talking to us about it and that you do your own podcast because I think, like,
Mm.
it was really interesting, like, up until, like, I guess, like, a couple of years ago, like, these are things that I had never really heard about, and then
Mhm.
suddenly and like you were saying, it is really common. Just
Yeah.
kind of like, suddenly, like, a couple of my friends were like, "Oh," like, finally talked to a gynecologist,
Yeah.
finally talked to a doctor about this, and, they like, turns out they have PCOS, or turns out they have endometriosis. I have, like, one of my friends, has been, like, struggling with her periods for years because like, well, she has, like, more of an absence of periods, and
Hmm.
I think it was, like, there was one whole year, like, without hormonal birth control or anything, she didn't have a period, and then finally,
Hmm.
someone was like, "I think you might have PCOS, like, let's examine you." That's like, it's wow, it's crazy to me
Yeah.
that, like
Like some people come
yeah.
in and I'm like, "Oh, tell me about your period." Let's say it's their first visit with me. And I'm like, "Oh, your period's regular?" They're like, "Yeah, they're regular." I'm like, "Okay, how often do they happen?"
Mm.
Well, like every 5 months." I'm like, "That's
What?
not normal." I'm like, "Come on, let's talk about this. Let's delve into this. We have to figure out what's going on." But these,
Yeah.
I mean, I also think that a lot of PCOS, endometriosis, a lot of women's issues are just coming to the
Mm.
forefront now, which is
Mm.
great.
Mm.
a lot of the internet's talking about them, celebrities are talking about them, unfortunately things like that actually makes our issues more heard, but at least they're happening. So I
Yeah.
feel like a lot more women are coming to me with the right words, or, kind of understanding that this might not be right. Let me at least
Mhm.
talk to a doctor.
Yeah, I think it's
Mm.
fantastic. Like even just, in my own family, I remember I think my mom had some difficulty getting pregnant, back in like the 70s after she got married.
Hmm.
And what did she told me that the doctor told her that she had an inhospitable womb.
Oh gosh. Yeah.
Just like yes,
Yeah.
it's so vague and I'm just like I don't think your doctor knew what was going on, mom. Like
Yeah. That I hate those terms, and those are very old school
yeah.
terms.
So yeah.
Just to say that and then to just be done with it. Like just to say that and like you're leaving the
Yes.
office. Like what does that
Mm.
Yeah,
even mean?
exactly.
Yeah.
So, yes, I'm so thankful for modern medicine.
I
So,
know. I know.
yeah, so another kind of pivot, this is more of like a sex-related question.
Yeah.
Is there such a thing as a G spot? Because it's something that I hear a lot about, and then I hear like, I've got a lot of friends who like, they talk about their sexual, like, experiences, and they say, "Oh, I've never had an orgasm. My boyfriend can't find my G spot." But I've heard, like, mixed information about that.
Yeah. So it's never really been proven if there's a
Okay.
G spot or not. It's not consistently found in each person. I've seen studies where they do like imaging, trying to find a nerve bundle, because that's what the philosophy is, that it's like a nerve bundle on the anterior part of the vagina that's really more sensitive and can lead to an orgasm. And people have searched for it, and there's just really inconsistent results. So I would say the jury's still out. I don't know if
Mm.
I'm a believer. I really think that female sexual pleasure mainly comes from the clitoris. When it comes to like making that orgasm like happen quicker as opposed to a particular spot in the vagina.
Mm.
But
Mm.
I think people are still searching for it, but I don't scientifically it hasn't been proven.
That's so interesting because I feel like it's such a common thing. Like you open up, those like I'm
Yeah.
imagining like a Cosmo magazine and
Yeah.
it's like how to find your G spot. Like I feel like pop culture has really like latched onto the idea of a G spot.
Yeah, I don't know why. There's even procedures that people have been doing to try to enhance the G spot, like
What?
inject different things into the vagina to make it more plump, and it's been, kind of poo-pooed by our society. The gynecologist society is like, these procedures are not proven. Not this is not proven. The G spot is not proven. Like, please stop kind of promoting these things. So
Yeah.
yeah.
Yeah, so, I was talking about this with a friend the other day, and then, Sam and I actually have a friend who's experienced this. And I just kind of wanted to know, like, how common or uncommon are miscarriages? Because
Hmm.
I think a lot of people who miscarry, they feel like, it's a huge amount of kind of guilt,
Hmm.
honestly,
Mm.
and, they feel really horrible about it, of course, like, like aside from just, what's the word I'm looking for? Like mourning, they also have like this guilt on top of it. But, I've spoken to a lot of people who have
Hmm.
experienced miscarriages. So,
Hmm.
I'm kind of wondering like, well, how exactly common is it?
So the statistic is every 1 out of 4 pregnancies will end in a miscarriage.
Wow.
Wow.
Yeah, so it's relatively common, to be honest. And it's another issue that I'm glad is being talked about more, because it used to be so silent, like if you have a
Yes, right.
miscarriage,
Mhm.
you suffer alone and nobody knows, and it's just very damaging to the family, to the female, to the psyche.
Mhm.
So I'm glad people are talking about that more. But yeah, it's pretty common. That's why, unfortunately, as an OBGYN, when people come to me and they're pregnant, I try to be as excited as I can for them, but in the back of my mind, especially when they come to me very early, I try
Mm.
to, I don't know, kind of set expectations. Like, congratulations, I'm so excited to make sure you're doing this, you're doing that. Come see me. Let's get through the first trimester, because it's way more common to have a miscarriage too in the first trimester.
Right.
So I try to be as excited for the new family and the new mom as possible. But when
Mhm.
you come to the OBGYN, like, we're always thinking, I don't know, we just think of all the bad things because it's just so
Yeah, I can
it's
imagine it's like
bad.
you know everything that could potentially
I know,
happen.
and I hate to say it because I love to be excited for my friends and my family and my patients, which I am, But
Yeah.
also, it's fine. I'm the doctor. I'll take the burden of just watching these things. So we've known that these things are common for a long time,
Hmm.
So not only just miscarriages, but there's even a type of miscarriage that's a blighted ovum where you just make an empty sac with no baby inside of it. There's so many things that can happen in
Oh.
pregnancy. Like, I truly think pregnancy and having a baby is a miracle just because I know of all the things that can go wrong or go the other way. So to get
Mm.
through to it is just, I mean, it's amazing. And when you have one miscarriage, it doesn't mean that you'll continue to have miscarriages all the time. So
Mhm.
most women that have 2, 3, 4, 5 kids have had one miscarriage at least at some point.
Mm.
Interesting.
Yeah. So they're very, very common. And they're very sad when they do happen. And it's,
Yeah.
mom always wants to blame themselves and things like that. And it's usually
Right.
never their fault.
Yeah.
Yeah.
I think thank you so much for saying that because, like,
Yeah.
I feel
Mm.
that way when, my friends talk to me about that, and I'm just like, you did everything right. It's just
Mhm.
Yeah.
sometimes, yeah. And, like,
Oh, yeah.
even
You
it
can do
happens more than I
everything.
thought it happened because I was just like, "Yeah, like, I've heard a couple people, but, like, gee, 1 in
Yeah.
4."
Yeah, it's super, super common. Nobody really used to talk about it, so we didn't, or most people don't know that. But 3 out of 4 have a baby.
Yeah,
Yeah,
that's
yes,
true.
yes, look on the bright side.
Like, the glass is
Positive
more than
note,
half
yeah.
full.
Yeah.
Well, thank you so much for sitting down with us today.
Yeah, you're
We
welcome.
appreciate all of the insight and sort of like just like brain drops you just like gave us. And we're truly grateful that you came and joined us today.
Thank you guys so much for having me. This was great, and I will do this anytime. We can talk about anything.
Oh my god,
Yeah.
yes, of course. Oh my gosh, we would love to have
This
you
was
back.
great. Thank
Oh,
you.
so if our listeners want to learn more about vaginas, or hear more of you, where can they follow you?
So on Instagram, I'm at For Vaginas Only. My podcast is also called For Vaginas Only. It's on iTunes, it's on Spotify, it's on basically everywhere you can listen to podcasts. And I also have a webpage that you can get links to my Instagram and my podcast, and that's forvaginasonly.com.
That's it for today, folks.
Thanks so much for tuning in.
And as always, please support this work by subscribing and donating to our cause at www.teamgetoveryit.com.
Donors get access to specific content like stickers, t-shirts, and postcards from our journey.
You can donate for as little as $5 and the benefits build from there.
Go to our website for more information.
Or find us on Facebook, Instagram, and Twitter at Team Get Over It.
Thanks for listening.
And catch us next time on Get Over It.